Today we will discuss about understanding muscle tissues massage therapy in Thai massage services video. Please don't forget to subscribe our channel. Cross-bridge theory of muscle contraction. If you imagine the myosin and actin filaments in fully overlapped position, then you can see how muscle tissue that is shortened in this way can do no further work. The neuromuscular junction, the point of contact between the nervous system and the muscular system, is the neuromuscular junction. Synapses, which are the points at which nerve cells communicate chemically with each other, also exist between the motor nerve cell and the muscle. Since muscles cover a lot of territory and different parts of them must function in different ways, a nerve made up of many neurons can innervate, or have nerve endings, neuromuscular junctions, with many different locations on a muscle. Although each muscle cell, fiber, is innervated by only one neuron, each neuron may innervate many muscle cells. A particular neuron and all the muscle cells that it innervates is known as a motor unit. This neuron extends an individual axon branch to each muscle fiber. Each muscle fiber has a single neuromuscular junction, approximately at its middle, composed of a cluster of axon terminals. These are the points at which the impulse to contract is communicated from the nervous system to the muscle. Individual muscles are comprised of fascicles, or bundles, of muscle cells, fibers. These smaller bundles are held together to form larger bundles and are separated from each other by connective tissue, deep fascia, myofascia. The source of energy within muscle cells is called adenosine triphosphate, ATP, derived from the metabolism of glycogen, a form of glucose, stored in the muscle. When muscle tissue is excited by the nervous system, it recruits a number of motor units based on the strength of the excitation. If the excitation and, therefore, the contraction are sustained, then some motor units may experience exhaustion, that is, they deplete their supply of ATP. As this occurs, other motor units are recruited to relieve them. As the excitation increases, additional motor units are recruited. Muscle architecture. Muscle architecture is the arrangement of muscle fibers relative to the axis of force generation. It is one of the most important aspects of muscle anatomy for massage therapists for two reasons. The arrangement of the muscle fibers determines the kinesiological function of the muscle or that particular part of the muscle. The direction of the fibers in a particular section of a muscle will often determine the direction and type of the work to be done. For these reasons, it is important to learn the architectural characteristics of each muscle. The term used to describe the angle of the fibers to the force-generating axis is pennation, and muscles fall into several general categories. Muscle architecture. Pennate unite. Pennate fibers lie at a single angle to the force-generating axis. Examples: vastus lateralis and medialis. Bipennate fibers lie at two angles to the force-generating axis. Example: rectus femoris. Multipennate fibers lie at multiple angles to the force-generating axis. Example: deltoid parallel, longitudinal fibers are parallel to the force-generating axis. Example: biceps brachii. Convergent fibers from a broad attachment converge to a narrow attachment, forming a fan shape. Example: pectoralis. Major tender points, trigger points, release. In examining clients, you will find points on the body that are tender when pressed. Assuming no other explanation exists for the tenderness, such as bruising or other injury, these points are called tender points. In the treatment system called strain counter-strain, or positional release, developed by the osteopath Lawrence Jones, these points occur in a systematic fashion. They are treated by placing the muscle indicated into a passively shortened position until it relaxes and the tender point dissipates. A myofascial trigger point is a point found in a nodule in a taut band of skeletal muscle tissue that is extremely tender and refers or radiates pain in a characteristic pattern. Trigger points are produced by muscle stress, such as overwork, repetitive motion, or sudden excessive stretch. An active trigger point is one that is spontaneously producing referred pain in the client. A latent trigger point is one that produces pain only when pressure is applied in palpation. A primary trigger point is one that is caused by muscle stress. A satellite trigger point is one that is produced secondarily by a primary trigger point. The term release is commonly used by massage therapists to refer to the softening and lengthening of soft tissue in response to therapy. A trigger point is said to release when its nodule is felt to soften and it ceases referring pain. A muscle is said to release when it relaxes while a therapeutic maneuver is being performed. Fascia is said to release when the therapist feels it soften and lengthen. Although the therapist's sense of release in soft tissue is a subjectively experienced phenomenon that is difficult to describe, it is difficult to miss when you do feel it, and it is a very gratifying feeling for therapist and client alike. Agonists and antagonists for virtually all skeletal muscle tissue, corresponding muscle tissue pulls in the opposite direction. Although the actual relationships of such corresponding tissues is complex, we generally refer to muscle pairs as agonists and antagonists, the agonist being the muscle that is carrying out the motion in question and the antagonist being the muscle that opposes this action. A simple example is biceps brachii, a flexor, and triceps brachii, an extensor, which oppose each other by flexing and extending the arm at the elbow. Not only do these opposing forces produce opposing movements, but the two muscles work in a coordinated way to produce a smooth movement in both directions. When a muscle is contracting to flex a joint by shortening, it is called concentric contraction. When a muscle functions as the antagonist and contracts to control the movement of a joint while lengthening, it is called eccentric contraction. The antagonist must overcome its normal resistance to stretch for movement to take place. This inhibition of the stretch reflex in antagonists is called reciprocal inhibition. We need to be aware of this relationship between muscles because it is reflected in clinical problems. A balance in strength between agonists and antagonists is present under normal circumstances. When muscles are weakened, excessively strengthened, or injured, this balance is upset. When we find a problem of any kind in a muscle, we are very likely to find a problem in its antagonist. Fascia. Fascia is a Latin word meaning a band or a bandage. It is the most pervasive type of tissue in the body. It is everywhere, like ivy on old buildings. It is the infrastructure of the body. Fascia not only gives the body its form, both inside and out, but it also provides the scaffolding for all of the other systems of the body, such as the circulatory, nervous, and lymphatic systems. Fascia might be considered the skeleton of soft tissues. Fascia is a type of connective tissue, which takes other forms such as tendons, ligaments, aponeuroses, and scar tissue. It takes different names in different places. Around the brain and spinal cord it is the meninges, around bones it is periosteum, around the heart it is pericardium, lining the abdominal cavity it is the peritoneum, and covering the entire body in a layer just under the skin, and enclosing muscles and sections of muscles, it is called fascia. Fascia serves the following functions: it forms and supports. It gives shape to the body and its component parts and holds them in place. It restricts. By providing firm boundaries, it increases muscle strength. Muscles from which fascia has been removed are significantly weaker. It guides and molds. Damaged bone deprived of periosteum does not heal within appropriate boundaries. It contains and compartmentalizes. Fascia contains and channels body fluids, helping to prevent the spread of infection. It provides infrastructure for branching systems. It supports capillaries and vessels of the circulatory and lymphatic systems, as well as the ubiquitous branching of the nervous system. It gives rise to new connective tissue. Fascia contains connective tissue cells, fibroblasts, that can specialize as needed to thicken connective tissue, help repair tendons and ligaments, and form scar tissue. Ironically, the healing and restorative functions of fascia can also lead to problems. Enveloping tissues as a spider envelops its prey, fascia can form adhesions between structures that should remain free. It alters the internal structure of muscles with deposits of gristle, fibrosis, that produce pain and limit movement. Such tissue hardens and contracts with time, becoming increasingly refractory to corrective treatment. One of the most important things to understand about fascia is that all fascia throughout the body is continuous. This fact is the key to the importance it is given by many body workers. Fascia is often compared to a knit sweater, in that a pulled thread anywhere on the sweater will result in a distortion of its shape in places distant from the pull. Many therapists feel that fascial distortions and fascial work have an effect over the whole body, including the internal organs. The pioneer of fascia-centered bodywork was Ida Rolf. Virtually every therapy focused in any way on fascia is grounded in large measure on her theories and her work. Rolf observed that fascia is made up of collagen fibers in a colloidal ground substance that varies in consistency from gel, the solid or semi-solid state of a colloidal solution, to sol, the liquid state of a colloidal solution. When energy, such as pressure or friction, is applied to a gel, it moves toward the sol state. Rolf theorized that applying energy manually to the fascia can turn the ground substance from gel to sol and make the direction and distribution of the collagen fibers more elastic and malleable. Since fascia is continuous throughout the body, the therapist can adjust the body stocking of the superficial fascia by releasing restrictions in the deep fascia and breaking up adhesions between fascial layers that restrict free movement of tissues against each other. Anyone who has worn stockings, pantyhose, tights, or any other tight-fitting garment knows what it is like to have that garment become twisted out of its proper position. It is an unpleasant, nagging sort of feeling. Fascial therapists believe that the fascia, like a body stocking, can become misaligned through habitual body misalignment, and they attempt to loosen, stretch, and realign the superficial fascia manually by means of various techniques. Superficial fascia. The superficial fascia is also called the hypodermis, talar subcutanea, subcutis, or stratum subcutaneum. It is located directly under the skin and contains fat, fascicles of muscle tissue, cutaneous blood vessels and nerves, and about half of the fat in the body. The orientation of the fibers of the connective tissue, collagen, fibers of the dermis follows lines called Langer's lines, or cleavage lines, the direction of which varies from one body area to another. The fibers in a particular region are aligned against the predominant forces experienced by the tissues in that area of the body. Surgeons often follow these lines in making incisions to minimize scarring. Deep fascia. The deep fascia is the entire fascia that is deep to the superficial fascia, with which it is continuous. For our purposes, deep fascia includes the fascia covering a group of muscles, investant fascia, the fascia surrounding the muscles, epimysium, the fascia surrounding the fascicles within the muscle, perimysium, and the fascia surrounding the individual muscle fibers, endomysium. Each of these layers of deep fascia gives rise to the next deeper layer. Although one of the roles of deep fascia is to restrict the outward, lateral, force of the muscle in contraction to direct and increase contractile force, excessive restriction or limited elasticity is counterproductive. Also, as described above, fascial surfaces can develop adhesions that prevent muscles from sliding smoothly against each other in movement. These adhesions must be broken up to restore smooth and pain-free movement. Types of fascial treatment. Extensive treatment of fascia is beyond the scope of this book, but students need to be thoroughly familiar with fascia and its relationship to muscles and remain aware of the importance accorded to fascia by many treatment modalities. Langer's line. Skin rolling. In treating muscles, you are treating fascia. Trying to deal with muscle and fascia separately is like trying to deal with a bubble separately from the air inside it. The term myofascial is indispensable because muscles and fascia are part and parcel of the same package. However, just as a particular muscle can be treated in an area where several muscles lie in layers by the intention, depth, and angle of pressure, the fascia can also be singled out by intention and specific techniques. Several different approaches to fascial work can be used. Skin rolling is a technique in which the tissue is picked up from the surface between the thumbs and fingertips. Both hands are usually used in skin rolling. The purposes of this technique are to increase flexibility in the superficial fascia and treat tender points in the fascial layers. Myofascial release is a system involving the gentle stretching process, often using two hands to engage and stretch the fascia and move with it according to its inclinations, as sensed by the hands. Directive fascial approaches include the following. Myofascial therapy is other directive approaches to the reorientation of the fascia. The latter makes a point of working along Langer's lines, whereas the former two do not. These descriptions are oversimplifications. Therapists interested in learning more about these modalities will need to study them in greater detail. Myofascial release. Directive fascial work. Neuromuscular therapy. Neuromuscular therapy is a system of myofascial treatment in which the thumbs are the primary instruments used to engage and release the fascia. The two chief schools of neuromuscular therapy are the British, Leon Che Ito, and the American, Paul St. John, Judith Walker Delaney. Treating the fascia. Fascial work is often a helpful precursor to specific muscle treatment, as it warms and stimulates the tissue, and gives the muscle added freedom to expand into its fascial sheath. In the ensuing chapters on treatment, we recommend and describe specific fascial treatments for the torso where we feel it is especially important. However, the principles of fascial treatment are easily transferred to other areas such as the limbs, and their application is helpful over the entire body. Palpation of the fascia is a skill that can be learned only by experience. Place your hand lightly on any broad surface of skin, and take a few moments to become aware of the skin. Then allow your pressure to increase slightly, and become aware of the superficial fascia underneath the skin. Gently move the skin and fascia back and forth with your hand, becoming familiar with the feeling of moving both layers. Now allow your pressure to increase even more, sinking more deeply into the tissue, and become aware of the fascia as a sheath covering the muscle tissue. Whenever you do fascial work, take the time to engage the fascia in this way. Once you have familiarized yourself with the sensation of touching the different layers, body mechanics. Before addressing specific treatment techniques, we must first consider the demands of the therapist's body and the safest and most effective ways to use it. Body mechanics is the key not only to safeguarding your own body integrity, but also to the performance of effective therapy. It consists entirely of the use of common sense with regard to the placement and the movement of weight in relation to gravity. Clients will often ask, "Oh, don't you get tired?" Or, "Oh, don't your hands hurt?" If you have mastered good body mechanics, the answer will be numbered. Just as massage therapy should take a holistic view of the client, the therapist must think of body mechanics in a holistic way. You do not work only with your thumb, your fingers, your hands, or even your body. You work with your whole self. Your approach to body mechanics, even though elements of it focus on a small area, must take your whole person into consideration, from your emotional attitude to the position of your thumb joints. Weight and gravity are the foremost mechanical considerations in body mechanics. We take gravity so much for granted that we seldom give it much thought, leaving our relationship to it in the hands of unconscious behavior patterns established early in life as we were learning to walk. But some activities require a conscious awareness of gravity. Dancers, for example, must relearn their relationship to gravity. So should massage therapists, because our work is largely based on the application of pressure, which is best accomplished through the application of our body weight. Therefore, the first principle of body mechanics is, use your body weight, rather than muscle force, to apply pressure. Using your body weight requires less work. Using muscle strength to apply pressure in massage therapy quickly tires the therapist, particularly the local muscles used for the purpose. In addition, the use of weight applies a smoother pressure, lacking in tension, than the use of muscle force. When muscles sustain a contraction over even short periods of time, the process of recruitment and exhaustion at the tissue level results in an uneven pressure, which communicates a sense of tension to the client. To experience this difference, let someone apply pressure to the same part of your body, using the same point of compression, palm, thumb, knuckles, etc., with muscle force and then with body weight. Observe the difference in sensation of the pressure. You do, of course, use your muscles to stabilize your joints. One of the chief functions of muscles in the body is to stabilize joints, and when using your body weight to apply pressure in therapy, this stabilization becomes a key element in the overall process. Therefore, keep the joints through which your weight passes relatively straight, but not locked, and avoid.
If you are visiting Manchester and in need of relaxation, there is no better place to go. All this and competitive prices mean that